Hello lovely people, welcome back to my channel. This is Noelum the Balanced Nun, and it's so lovely to have you guys back on this channel. I was going through the street of YouTube recently and I saw people talking about it, like two YouTubers that I watch talking about it. So I was like, why don't I talk about this? So just in case you've not met me before, my name is Chinoelum Blessing Ofodile. I'm a nurse and a midwife who was trained back home, which is Nigeria. Yes, Nigeria is back home. Last year, I gave birth to my second baby, so I am in the right place to talk about what I want to talk about. So today's topic is going to be looking at what you are going to expect as a pregnant woman after delivering your baby. So during pregnancy, most of the time we are usually very anxious, we're searching for information just to have an idea of what the delivery process is going to look like, what is going to happen after delivery of your babies, and this can actually be a source of anxiety to so many people. So today I'm going to be providing some of this information to you, and with my experience as both a midwife and a nurse. So please, if you have not joined the family, do well to subscribe and turn on your bell notification so that you will know whenever I post a new video. It's free. It's going to help the channel grow and also reach out to people who would like it. So don't forget to also like if you like the video and comment in the comment section so that we'll get to have an interaction with you. For the course of this video, I'll be looking at three main subheadings: what you are to expect with your body, what you are to expect with your mind, what you are to expect also as a mom. So the first thing first, you being a mom is a beautiful thing. You being able to go through pregnancy, it can be demanding, it can be exhausting, it can be exhilarating as well. It can be a beautiful experience, and congratulations for coming this far. I know there are a lot of people who are still waiting, and I am praying that the Lord is going to give them the opportunity to experience what every other woman who has gone through pregnancy is experiencing. First thing that happens to everybody, whether you gave birth to your baby through the vagina or you gave birth to your baby through cesarean section, you might feel an after pain immediately you put your baby to breast. After you propel your baby out and your baby is no longer in the uterus, immediately the brain registers that something has left the body. So those hormones that are there to protect the pregnancy goes off. So another hormone actually comes in, signaling to the brain. So when this brain to start producing milk production starts happening, that is, most of the time they will tell you to put your baby to breast. Immediately it starts happening, what happens that another particular hormone called oxytocin is being released. And when this oxytocin is released, it starts acting on your uterus, which makes it to contract. There is contraction going on, this is why you're having cramp. To be fair, it is very okay physiologically because it means that your uterus is contracting well, and there is something called evolution that is going on. Evolution is just the process whereby your uterus and every other part of your body starts going back to its pre-pregnancy state. Your body has to start taking that process of evolution, start shedding those properties that it acquired for the baby to stay and incubate in your womb. So whenever you see such things, please, or you start feeling the pain, just bear it. But when the pain is unbearable, that you should tell the nurse that is with you, tell your caregiver, let them know that the pain is too much so that they can examine you, just in case. Most times they just give you bowel and analgesia, and with the amount of analgesia you should be okay. When the pain becomes so much that it's unbearable, another further test will be done just to make sure that you are okay. Another thing you are going to experience immediately you give birth, even if it is vagina or cesarean section, is lochia. So lochia is a kind of bleeding or kind of discharge, just like a menstrual flow, but this one is more than the menstrual flow. In as much as it's more than the menstrual flow, you're expected not to produce more than 500 mils at a time. This lochia starts immediately your baby is propelled. Immediately the membrane is out of your body, the bleeding starts. So the bleeding is normal because what it does is it's trying to shed off all the baby properties that is in your uterus at the time of pregnancy. So whenever you start seeing those things, you should understand that it's normal for it to happen. Whenever you are preparing to go to the hospital, make sure you have cotton pads, because most of the time your regular pad will not do the job. It's always very important for you to monitor how much you are bleeding, because you are not supposed to have up to 500 mils of bleeding. Whenever it gets to 500, it might actually indicate postpartum hemorrhage. But what I'm trying to make you understand is to realize that this thing is going to happen. It's not that it's going to happen. Whatever is out of the norm, you have to report it immediately so that if there is any intervention that needs to be given to you, you will receive it. So basically, whenever you start saying anything that is out of norm, don't hesitate to ask your midwife, don't hesitate to ask the nurse or any professional caregivers that are around you, or even your relative. Let them know what is happening to you so that they can actually look and seek for care for you. And the local normally stays for about 14 to 6 weeks. Your body is trying to shape these things, but gradually from bright red to start turning to pink, from pink to start turning to brown. Another thing also that you have to see if you give birth to your baby through the vagina is you might have parental discomfort. Remember that the baby went through that part, so definitely the parental discomfort is going to happen. Sometimes you might not be able to sit down properly. Sometimes going to the toilet will become a problem because you feel a lot of pain that area, especially when there are lacerations, there are some cuts, or you even had an episiotomy. The whole thing, maybe they have sutured it, you will still feel the pain, you still feel the tenderness. Some of the things you can do to alleviate the pain is that they will give you some kind of pain relief or some mild analgesic that's going to help the pain. It's not saying that the pain relief do much things, but at least it's going to help you very much. Some of the things you can do is sit back, that is getting water and sitting in it. Another thing that might happen to you for people who had cesarean section is they might react to the anesthesia that was given to them during the surgery. We are going to be instructed on how to take care of the incision site. So another thing also is going to the toilet might actually be a little bit difficult. Of course, you carry your baby, the pressure might actually be there, but the only good thing is that you'll be able to sit down if you want to sit down. You can be able to ambulate immediately. Immediately all the effects goes off, you'll be able to ambulate. Like, so just push yourself and try walking around. The only thing I'm going to tell you, please, if you went through cesarean section, do not lift heavy objects. And secondly, please leave your tummy alone. Don't say I want my tummy to return back to normal and you start tying things on your stomach. Especially allow your stomach to breathe for the next 3 months. After 3 months, you can start wearing all your girdles. At least it's assumed that your incision sites are healed. Another change that will happen to both people that gave birth through the normal vagina or cesarean section is that you start having breast changes. So your breast now will start having milk. Remember I talked earlier about prolactin. Your brain will start communicating and prolactin production will come in, which is going to prompt your breast to start bringing out milk. So your baby is being placed to breast, then you start having breast engorgement because breast milk will start coming. So some people, the breast milk will start coming so much that they will start having pain, which is engorgement. Sometimes you start having soreness where the baby is suckling. There are ways that you can use to help yourself. One, you can express milk using breast pump. So when you are buying things, don't forget to buy breast pump. It helps a lot. And also feed your child as demanded. I know sometimes it can be a bit of a challenge, but just go ahead and feed your baby as much as the baby wants. And also, if you are feeling sore, there are some creams that can help you manage cracked nipples and all. That was something one of my friends recommended to me sometime when I was complaining that I was having sore nipple. This is just like a plastic that is being placed on the breast that has an opening that helps when the baby bites on it, it doesn't go directly to your skin. I think maybe you can try it. I have not tried it out. I never used it, but yeah, it can happen. Another way to even take care of it, you can even use Vaseline on it. But the only thing is, when you apply Vaseline on your nipple, remember to clean it up before you feed your baby. All right, now we've talked about the physical things you might experience when you give birth to a baby. Let's talk about the emotional part of it. When you are giving birth to a baby, it is okay to feel exhausted. Sometimes you feel exhausted, you want to sleep all day. Sometimes you feel overwhelmed with you being a new mom. It is all fine. Remember that you just gave birth to your baby. This particular issue is called baby blues. So yeah, you just give birth to your baby. It's normal to feel overwhelmed. It's normal to feel the way you're feeling. Sometimes you can be anxious. You want to keep on being apprehensive to look at your baby. Is the baby still okay? It is all fine. So yeah, it is all fine. It can be exhausting as well, but the only thing you have to make sure that it does not become chronic. It doesn't last for a long time, right? Then ask for help when you need help. If you need to walk away, please drop the baby. Even when the baby is crying, the baby will be fine. The baby is not going to die. Just walk away for a while and come back and pick up your baby. Another thing you have to expect is sleep deprivation. Now, this baby is still new, and whenever he wants, he eats. The baby eats when the baby was in the stomach. The baby is not going to really change that much because he doesn't really know the difference of being in the stomach and being out. So he's going to still require for you to breastfeed or eat. Definitely, the baby has to cry because that is the only way they know how to communicate their feelings. Whenever your baby is sleeping, it's always advisable to sleep with your baby. Another thing also, when the baby starts crying so much, most of the time is what we call colic pains. There's actually nothing you can do about it. There are some recommended stomach medication that is being prescribed, something like Enfacool that is being recommended. Just ask your GP, they will be able to recommend a good one that is suitable for your baby. Another thing also I want to talk about breastfeeding challenge. So some people might have breast milk coming, some might not have their breast milk coming. So it is all normal normal. So for those people who had their breast milk coming, it is always good. Thank you. God bless you. Continue. For those ones who are still having issues with their breast milk coming as regular, you have to maybe start shaking up your meals just to make sure that you incorporate some things. Another thing is also for emotions when you're having signs of depression, which is postnatal depression. So most of the time, postnatal depression is usually seen in new moms. So you should understand or know when you start slipping into depression. Baby blues is fine, but now when it becomes chronic, when it's persistent, persistently you're overwhelmed, persistently you're anxious, persistently you have low mood. So one of the things you can do is speak to your partner, speak to people around you, go and seek help. One of the signs you will see that some women feel bad that they give birth to the baby, they feel that they are not good enough, the mothers, and all. Yeah, it is all okay, but the only thing you need to do is to seek help whenever you start feeling that way. Communicate to your partners, and partners, please observe your wives, observe your spouse, and make sure that they're not slipping into depression, because sometimes they might be going into it and they don't even know. You can just say, okay, just come around, let's just go for a walk, take them to the GP, let them speak with them, and also start off the treatment. Let's go to the next point, which is the physical part of being a mom, that is in the role of being a new mom. So number one, it might be hard adjusting to the role of being a mom. That you are pregnant does not really prepare us for what we see, because when you are pregnant, you're carrying the baby in your stomach. You can easily sleep when you want to sleep, wake up when you want to wake up, do what you want to do, and carry the baby around as you're walking. But now when you're a mom, a new mom, there are a lot of things that comes to place. Your baby needs to go for this particular checkup, people are coming to see the baby. You have to also take care of the baby, take care of yourself, take care of the older ones if you have the older ones, and all these tools can be very, very overwhelming. So yeah, it happened to me. So at some point I was like, I don't think I can take it again. I was about running mad. I was not running well, really, but it's a good thing. You should understand this is a good process. Nothing is wrong, actually. So it's for you to just adapt it to the role, try as much as possible to ask help when you need help, and you will be fine. So there are also changes to your relationship. Now, the new baby is there, you're concentrating on the new baby. There might be lapses with how you deal with the older ones, and they'll start feeling jealous. They start feeling jealous. So maybe you have a little baby and you're no longer paying attention just the way you used to pay attention to the baby, then they'll start feeling jealous. Your husband might start feeling that, oh, you're now bonding with the baby too much and you're not giving them time. So you should understand that all this will happen as much as you can. Just try and incorporate them. Let them understand that the baby needs more care than they would need. The baby needs more attention than they would need normally. And your partner also, remember this woman has gone through a lot, their body has gone through a lot during the 9 to 10 months they are pregnant. Please give them the whole support they need. Even when they're not paying so much attention to you, you also should support them. Make them feel that they are loved, make them feel that they are seen, because they are going through a lot. It's not easy going through that process. So give them the support they need as well. As an Igbo girl, there is a culture called omugo. So this omugo is what we use most of the time. So the mother of the child comes to stay with the woman even before they give birth to the baby, just to support them, because they have gone through this. They are older women. They have gone through this, so they help them to sink into the role of being a mom. So another thing is the importance of self-care, food, hydration. You have to also understand that you should incorporate self-care, because most of the time it's your baby centered. It's all about baby, baby, baby. You don't even take a time to take care of yourself. You don't even take a time to have good hygiene, eat good food, take a lot of water. Yeah, but if you don't take care of yourself, you understand that there is going to be a problem. If you don't take care of yourself, it's going to report on your baby. So you should make out time also to take care of yourself. That is why I said ask for help. It's very important that you ask for help. Ask people for help. Let them also give you the support and the assistance you need. Okay? Don't be afraid of asking for help anytime, any day. Please give yourself grace and trust your instincts. So some of the time you might feel this baby is crying somehow. Maybe the baby has issues. You are right. Okay? Trust your instinct, because your instinct is one of the reactions that the first reaction that your body gives to you before something happens, or a reaction to what is happening that you're not picking, your brain is not picking. So before the brain will start picking something, your system already picked it. So whenever you have anything that's happening, just trust your instinct. Do it. Sometimes, most of the time, it is true. That doesn't mean that being paranoid is okay. Sometimes you can be able to be paranoid. Don't forget to incorporate some kind of healthy living in your lifestyle when you are at it. It helps to clear your mind. It helps to give you a lot of time. When your baby is sleeping, like I said earlier, please find ways to sleep. Okay. Please don't forget to subscribe, share this with your friends if you like them, comment in the comment section, and put on a bell notification so that whenever I post a new video, before, okay, let me even describe it. For you to post and put on the bell notification, is go to that place that is a bell, go and put all, personalize, put all. And whenever I post any content, you will get it first time. Thank you very much, and I'll see you in my next one. Bye for now.